Meningitis is maybe the most common. About 50% of the major Haemophilus influenza type B infections are meningitis, and it has a very high mortality. Okay, so new for you, epiglottitis. What is that? Epiglottitis is an infection of the epiglottis. This is the epiglottis. This is the epiglottis. Here. Epiglottitis is an infection, an inflammation of the epiglottis. And this is a medical emergency. Epiglottitis is a medical emergency because when the epiglottis is swollen, when the epiglottis is inflamed, sometimes the airway may become obstructed. This is the reason why this disease is so severe. This is a typical infection of children. Children with epiglottitis, wait a minute, please. With epiglottitis will suffer sudden disease with very high fever and sore throat and hoarseness and sometimes muffled cough. These children appeared in the tripod position. And what is this? This is a child with the tripod position. Look, you will meet some children with epiglottitis and they will appear like this, sitting. They are never lying on the bed. They appear sitting with this position. Look, this is a child with the tripod posture, with the tripod position. Look, the mouth open a little bit, the chin forward, and the neck extended. The child does not want to lie down. The child wants to stay sitting like this, because this is the best way for the child to breathe. This is the reason why they stay sitting. Look, this is the epiglottis. I show you here. This is the epiglottis. This is normal. This is a normal epiglottis. And this is a swollen epiglottis. This is the typical infected epiglottis, like this. So the problem of epiglottitis is that when the epiglottis is swollen like this, the airway is obstructed and the child can't breathe. This is the problem here. Can you notice the difference between the swollen epiglottis and the inflamed epiglottis? That is the problem. This is the reason. This is the reason why epiglottitis is a medical emergency. So please, when you have a patient, a child, and you think that the child may be suffering epiglottitis, don't do anything with the mouth. Any kind of manipulation, any kind of examination of the throat, for example, taking a swab, any kind of examination is contraindicated. Don't do anything with the throat of the child, because if we do it, sometimes the airway may become totally obstructed. So any kind of manipulation is contraindicated. What can we do with these severe diseases? What can we do with meningitis, epiglottitis, or pneumonia? What can we do? We can treat these diseases and we can prevent these diseases. What about the treatment? We are not going to ask you the antimicrobial treatment. Just to tell you that the best antimicrobial treatment are third-generation cephalosporins. This is the best treatment against severe diseases. We can prevent diseases with vaccines. We have a vaccine against Haemophilus influenzae type B, and we can do post-exposure prophylaxis. So I go to the table, and we are going to fill this table. So the treatment, antimicrobials. The best against severe diseases are third-generation cephalosporins. And the vaccine for prevention. We give this vaccine to children many times. So currently, these severe diseases are not very common in children because fortunately we have this vaccine. In some places where the vaccine is not available, children may suffer this disease and may die. Many years ago, before we had the vaccines, many children developed invasive disease, 1 every 200 children, before the age of 5. Currently, in some countries, they still have these diseases because they don't have the proper vaccine. Okay, so we don't say anything else about Haemophilus. And now we are going to study the second one, Bordetella. So I go back to here, and we are going to study Bordetella. I am going to remove the contents about Haemophilus, so we have enough space to write about Bordetella. So we are here, Bordetella. The most important species is Bordetella pertussis. The other one, similar but not so important, is Bordetella parapertussis. The most important for human is pertussis. The name of the disease is pertussis. Hence the name of the bacterium, Bordetella pertussis. Pertussis is the scientific name. In Latin language, tussis means calf, and per means a lot. So this is translated from Latin. This may be a lot of calf. You will notice later why. In English language, they call this disease whooping cough. Whooping is a type of sound that you will hear later in the video. Whooping cough. Okay, so we are not going to say anything about here. And what about the pathogenesis and virulence factors of Bordetella pertussis? Bordetella pertussis produces many toxins. Bordetella pertussis is gram-negative. So Bordetella pertussis has lipopolysaccharide. So they have endotoxin. And Bordetella pertussis has 3 potent exotoxins. I explained you the mechanism of action of these exotoxins in the class, so I am not going to repeat now. Exotoxins, 3 are the most important. The first one is pertussis toxin, PT. The second one is adenylate cyclase, AC. And the last one is tracheal cytotoxin, TC. They have different actions. Maybe the most important is pertussis toxin. And Bordetella pertussis also produces adhesins.